Good afternoon, everybody. Greetings. It's been, yet again, lots of conversation and challenges, and I am happy that people are here today to, again, talk about COVID-19 in our community and to learn what the updates are, and that we have an opportunity to answer questions as well. A lot has changed in the last 24 hours. We were here yesterday because there was an announcement from the governor's office that Secretary Palm had extended the order starting when the order ends next week, going through May. And so we talked about that yesterday during our media briefing. Today we'll talk about that a little bit more. The governor's plan, his strategy to safely move to opening up our society while continuing to control the spread of disease is a change for all of us to wrap our heads around and figure out how to help us move forward with that. The White House also announced a plan or a strategy for steps to safely reopen as well and safely get back to something that's closer to normal. I think all of us are ready to get back moving toward a new normal, and we understand that it's been hard. I also want you to know that our team, our incident command team, has been working really 7 days a week since this started to get Eau Claire County back to a place where COVID-19 isn't the topic of discussion at every event, and where we all are back to a new place with our families, with our work sites, in a place that works for all of us, where we're also safe from a disease that is something that we don't have any protection against. For those of you that are really struggling with all of this, I hear you and I understand. I'm struggling with it as well. Those of you who are worried, we hear that. And those who don't know when they'll have their jobs again or have an income again, that's a real health issue. Just like communicable disease is a health issue, having an income and not being in a place that is unsafe because of your poverty is equally a health issue. We care about that as well. Although I rarely go on social media, I did look a little bit yesterday, and I had a close friend posting about the difficulty they were having with the announcement yesterday about the extended order and the frustration that they had. Her daughter posted yesterday something that I thought I would share with you because she said some things that I probably couldn't say as well as she did. She said in her post, and she had previously posted with some big concerns about the governor's announcement, but she posted, "I had a bad day today." And then she went on to say, despite concerns expressed in a previous posting, that at the end of the day, she actually supported staying safe. She said it better than I could. I'll quote from her post, "I know that there are brighter days ahead, and in the grand scheme of things, doing whatever it takes now is so worth it. We have to take this day by day." I don't want to pretend that it's easy for any of us. It's not. I think the work that we do now, based on the science, based on what we know will make a difference in this disease process, it'll make a difference that we can then safely reopen for all to be back to a new normal. What our team continues to work on, and what we're working on with our community, is how to reopen safely. And we want that to happen in a way, people are talking about a smart restart. We want a healthy and safe restart so that we are successful in preventing that, the flattening of the curve that we have now being reversed. So a quick update for all of you on the status. In Wisconsin, we now have 4,045 positive cases, 170 new cases since yesterday. We have 42,365 negative tests and 205 deaths. More than 200 people have died since the really recent start of this in Wisconsin, an increase of 8 people. Again, our hearts go out to all of those people. Hospitalizations now of COVID-positive patients are now at 1,153 people hospitalized with a positive test. In Eau Claire County, we continue to have 22 confirmed cases, no increase from yesterday. Our testing numbers are at 1,447 Eau Claire County residents tested. 1,351 of those are negative. We do continue to have a broad range of positives, as I've said before, related to their age, and a mixture of genders, both male and female. The call center received 35 calls yesterday, and we continue to get a lot of questions. We're anticipating that continuing. A reminder that that call center number is 715-831-7425. We also want to note that there's a Google site reporting cases, and the Google source that is being used is not correct. So please visit our website for correct information on cases for Eau Claire County residents. Again, our website is coronavirus.ecehealthdepartment.org. The state health department website with cases on it does have a new feature. They do have a map with cases by county, and that map does show census tract data. So for those of you that are data geeks, you can look at a smaller parcel of space in our county to see cases, and that data is also available. Many other developments have been happening, and I'll talk through a couple of those today and then take questions. First of all, we've talked a lot about testing. It's one of our key strategies to getting back to our normal situation of following up on communicable disease and controlling it based on the positive cases we have. We do that with all other communicable diseases in our community, and our goal is to get to that spot. We need testing to increase to do that. We've talked a lot about that at previous media briefings, and the state has been working hard on expanding capacity for testing. The state last night sent out an update to all of our healthcare partners and all of our labs, really pushing hard for increased testing to happen. So the prioritization of tests will continue at the State Lab of Hygiene with those most concerning with the disease. So that's hospitalized patients and healthcare workers. State Lab of Hygiene, as I indicated earlier this week, is expanding their testing to include other populations as well. So individuals that are in congregate settings like jails and prisons, individuals in long-term care facilities, those places have the ability to get tests run now at State Lab of Hygiene as a priority, as well as the Milwaukee lab. The state is also encouraging all labs across the state, and we have many of them now. More than 7,000 lab tests can be run every day with the testing capacity that we currently have. The encouragement by those facilities out in our community is to start testing people with symptoms and even mild symptoms. So the directive from the state was to really move forward with continuing to prioritize those individuals as well. Increased testing is a factor in getting us to reopen, and we know that. So our encouragement locally has been out to those providers as well. We've been working for weeks with our healthcare partners on testing and supporting them as they are doing testing locally, and we are thrilled with the capacity that we have in our community. We're very fortunate to have strong healthcare providers here. They support the region really with testing and care for people that have COVID-19. We sent a message to them last night right after we got the 7:30 announcement from the state, asking them how we can support them, how we can improve the testing numbers that are happening in our community. We shared with them the Eau Claire County resident data, and made a very specific ask to them to work with us and work with the state to get those numbers up as well. It's not an easy road, and we know that. So we have healthcare providers that want to do this. They're having some barriers, and we're working with them, and the state is working with them to really work through those barriers that they may have. And we are confident that we will slowly start seeing those numbers increase. We know that with testing will come more need for follow-up of positive cases. We are quite certain that there are more positive cases in Eau Claire County than the 22 we've already identified. And we're working also on having that capacity be strong. Actually, the conversation I had before I came up today was with our team that is working on training and supporting new people to do the case investigation, which is really that serious work to make sure we understand everything about that positive case. And then the contact tracing work, having a team of people to do that as well. We have a really strong team right now. We're fortunate in this community to have that, and we're building that. We also know that businesses are struggling. So those non-essential businesses and small businesses that are not only have been struggling as this order has been in place, but moving forward with the order extended, we know that that's really difficult. Support for business is a regular conversation in our incident command team. We do have a specific business group in incident command that has been working with businesses. Our priority up to this point in time has been primarily supporting our essential businesses in operating in a safe way, and we're working very, very directly with them to do that. They've received resources, materials, signs. They've had people go out on site, whether it's a grocery store or another kind of existing facility, to really support them in doing what they're doing safely. So not only do the people that are coming into their store stay safe, but also their employees. We need all employees to be confident that their health and safety is kept as a high priority. We also are partnering very closely with the Chamber. So last week I was on the Chamber Town Hall meeting talking about COVID-19 and health and safety with that group. They are doing a phenomenal job reaching out proactively and partnering with us as they are working on this. Next week, Monday, we've invited Dave Miner from the Chamber to come back and talk with the group again about where things are going for businesses. This new order is hard, and we know that there are significant concerns and challenges. Our goal with the new order is to really work with our businesses to make sure that they have the tools and resources to safely reopen, that we support them so that we can do that as quickly as possible. And with the new order that will start next week, that all of the new capacity that they may have to open and function, that we are supporting real time those businesses and doing that successfully. The governor's communication this week about extending the Safer at Home order is hard, and it's really hard for businesses. We know that, and businesses are part of our community. They are our community. They're community members that all of us care about. As we step through that, I think our job is turning away from language about the problem with this order to really turning to language about how do we work together to make sure we open businesses so that the people that come into those businesses and the employees are as safe as possible. This disease is not going away at the end of May. This disease is not going away anytime soon. And whenever we open those businesses, whatever that date is, we need to do it safely so the people coming in are safe, and so the people working there are also safe. And we are very committed to doing that. So just like the elections, you may remember that we worked very hard, even though it was tough to say we're having the elections given the situation we had with COVID-19 across the state. But we did. We had the elections. We worked together to make sure that they had the information that they needed, that made sure that they had resources available, and they, even if they wanted, had someone talk and walk through how to arrange the voting to happen in a way that was safe. We are committed to doing that as well with businesses in this area. Things may look different moving forward with our businesses, and in the short term, they definitely are, but we're confident that the Chippewa Valley businesses that we have want to do the right thing, will support us continuing to make sure that all of us are safe, and that as a team, we can make this happen more quickly and more successfully if we're working together. So in closing, a reminder about our website and our COVID line. Please use those resources to get good, current information. I also want to say that each of us is feeling the challenge of all of this, and I know that that weight is there. There are resources available for people that need those resources, and we really encourage everyone to take advantage. This kind of stress does impact all of us, and having the tools and resources to manage that is critically important. It's also a time to take a minute to say what we're thankful for. And, I want to tell you that I am so thankful for this community and all the partners that I get to work with every day that are taking this seriously despite struggling, and working together for a common good. We may have different points of view on things, but I have been impressed day after day, conversation after conversation about the shared interest in having a successful and safe community. That makes me really thankful to be in Eau Claire. I don't think that that's true everywhere. I also want to say that I am one of those people that gives something up for Lent, like some of you do. I didn't give up chocolate for Lent, although my team will tell you that I really should probably give up chocolate. But what I gave up for Lent this year was saying, I wish. And I did that because when you say I wish, you are taking yourself down a negative road immediately. And I just, this was well before COVID-19 started, but I knew that personally, I needed to pay attention to the language I had in my brain. I ask people in the community to at least pause and think about, can you reframe how we think about this issue a little bit, despite this being very, very difficult? Instead of saying, I wish I could see my grandkids, and we know that people really want to see their grandkids, say, I miss my grandkids. And I'm so glad that we're keeping each other safe right now. I'll get to see them soon. So my ask is that if we can find ways to try and reframe, I think it will help all of us. It'll help people around us as well. Know that this road is difficult, and we understand that. And we'll be back on Monday to talk more. I'm sure we'll have more information. We'll have a bit more understanding of the new order, as well as where we're going with responding to the steps we are exactly taking as a state. And we'll continue to share the steps we're taking locally to really make this not an ongoing discussion about how we have to be just safer at home. So again, thank you for everybody for being part of this. I will respond to questions now. Yeah.
You keep going on with the more testing needed.
Mm-hmm.
What is it that I guess is holding that up? Is it training? Is it the supplies? Is it the personnel? Oh, I guess what kind of hurdles are these facilities facing that's kind of preventing more testing from being done?
Sure. So the question is really, what are the hurdles or what are the barriers from getting more testing to happen? They are different across the state. So there are some strategies happening at a state level to address things. My ask of the providers last night was really, tell us your local barriers to see if there's anything we can do locally. The usual barriers that we are seeing across the state include access to some supplies. So the state has worked together to have a distribution site for some of the supplies needed to do the testing, and they're working hard on that. The reagents, or the actual material that you use in the testing process at the lab itself, that's been a bit more difficult. So that reagent availability, that supply, has been something that across the state we're having challenges with, and it's not in the control of a local lab. So we know that that's an issue statewide, and that's being worked on, but it is challenging. The production of that type of product has been difficult. So that is a real barrier. We also know that there barriers exist for things like personal protective equipment, and barriers exist where healthcare systems need to have capacity to do increased testing, and they need to have the people on board and the policies in place to do that. So some of the current protocols locally are only to test higher risk people, which was what we were saying until more recently. And so to get those protocols to start changing and for the the local providers to build the ability to do that real time will take a little bit of time, but I'm confident that that will happen. Yeah.
At least there's been some pushback and some resistance to yesterday's extension, especially as far out as it is. What do you say to the people, especially some of those in less populated areas who maybe haven't seen a lot of cases yet?
Mm-hmm.
Why it's so important to continue to stay home, to continue to use social distancing, et cetera?
Yeah, so the question is, with the pushback that we've been seeing, particularly in some parts of the state where there haven't been many cases or we haven't seen much disease, what do we say to people like that? And even in Eau Claire, 22 cases may not seem very significant to some people. The real public health response is, again, that every single person in the state is susceptible to getting this disease, and we know it's a disease that is very contagious. The minute we open up, we know we will have more disease. So in low populated areas in more rural parts of the state, as well as in parts of the state like ours, the western side of the state, where we haven't seen quite as much disease because of timing, it's only a matter of time before it comes. And as we open up, those places will start seeing disease, and a strategic and planful approach, a safe approach to opening up is what all of us should want. Because whether you're in a rural area with no cases right now or very few cases, or you're in an urban area with a lot of cases, none of us wants to see more people very, very ill and dying. And that will happen across the state. Yeah.
Early on, it seems to me the message that I know I connected with was, hey, we need to flatten the curve.
Mm-hmm.
We agree with that. And then it seems like the reason was we needed to flatten the curve because we couldn't overrun our hospitals. Would you agree that that was the message? And then I asked that because it seems like now, are we still holding to that being the message?
Mm-hmm.
It seems like in more and more circles, because our hospitals here are certainly not overrun, then the question, people are saying, oh no, the real reason is we have to flatten the curve until we get a vaccine.
Okay, so the question is really about that whole concept of flattening the curve. And is it flattening the curve so that the healthcare system can be ready, or is it, like some may be describing, flattening the curve till we get the vaccine? It is absolutely not understood that we need to continue to flatten the curve in the way we are doing it right now until we get a vaccine. A vaccine is many, many, many months out. We'll be lucky if we have something by this time next year that is being deployed. We're hopeful it comes quickly, but I think most people are anticipating that not being a near-term measure. There are lots of public health strategies we use to keep case numbers low. Flattening the curve is being done with this specific measure because it quickly flattens the curve. So we will continue to work on flattening the curve to keep the number of cases at the same time low. The strategy of reopening society, having people leave their homes, and doing really, really good testing and case investigation is the next public health strategy to use. So it's not that we need to keep using this same strategy until vaccine happens. We need to do that until we have enough capacity to do good testing so we know who's sick, and to do the follow-up to keep that circle small. What we don't have right now, because they just came up with these tests, they're brand new, just like this disease is brand new, and because we don't have as much personal protective equipment as we need, because this is a worldwide disease, not a localized disease, and the demand is huge, and because we have not set up all of our systems for follow-up. We do a lot of communicable disease investigation in Eau Claire, more than 1,000 cases, but we will have many, many more than that with this. So all of us are needing to ramp that up. We've been doing that for the last 6 weeks, but it takes a little bit of time, and I know it's hard to be patient, but we will flatten the curve in new ways once we start opening things up, and that's this progressive reopening, the very strategic reopening that the governor's office and the state health department are working on. And that will make a difference. We will be able to reopen in a safe way if we do it slowly and in a measured way. And I understand that patience with that is extremely hard because it's impacting all of us. It's impacting us personally and in a business way. But if we don't do that, we'll have a lot of people sick and a lot of people dying. And there's lots of reasons that we don't want that. Yes? So the question is, have cases peaked in Eau Claire County, or are there cases yet to come? I think it's likely that we are at a peak for this time being under Safer at Home. I am confident that the actual number of cases that we have in Eau Claire has not peaked, and that will all be dependent on how well we have people following the Safer at Home orders and how well we do the next stage. So if we have good testing, if we have good case investigation and follow-up, if we have businesses that reopen employing really safe practices, I think the frequency of cases will be lower, but I am confident that we are not at the end of this.
Yeah, that was a follow-up question.
Mm-hmm.
What do you think a strategic reopening would look like? Now, I know that's a question I'm not going to answer to, but do you think that means fewer people in restaurants, some of these stores maybe temperature checks still? Do you have any idea what that would be?
Mm-hmm. So what might strategic reopening look like? I mean, that is obviously a conversation nationally right now. And if you look at the White House plan, they have actually laid out a stepwise strategy for that. The state has also slowly laid out that plan. I think we can all anticipate that there likely will be stages to that. And that will include things like avoiding mass gatherings of different sizes progressively out from where we are right now, where it's just your household. And we kind of walked into it that way, and I anticipate that will be part of how we walk out of this. And I think those will be the kinds of things, and then very clearly doing some specific things in our businesses to keep people safe a bit longer term will probably be important. Things like physical distance being something that we'll have around for a while in those public spaces. So those are the kinds of things that I would anticipate seeing, and from a public health standpoint, strongly encourage. Yeah.
Again, with the governor's order, golf courses allowed to operate with some restrictions. Things like campgrounds are able to operate with restrictions. Given the fact that those are starting to, I guess, be allowed, stores that would supply some of these things, outdoor stores, camper stores, whatever, do they, I guess, start falling into the essential business category as well? Are they allowed to start operating now? Can you maybe comment on that?
Mm-hmm. So the question is really around what becomes an essential business as we move forward, especially with the new order starting next week and perhaps subsequent changes down the road to how things get opened up. The governor's office, this is a new order for us, so we're still digesting that as the simple answer about what actually will be allowed to be open as part of this. The essential business list is something that Wisconsin Economic Development Corporation, their website, is keeping very current. The governor's order does have some clear guidance in their frequently asked questions about what businesses are considered essential, what businesses can remain open, and how. And certainly there is new opportunity for businesses to, with the order starting next week, to have some curbside pickup or delivery of items as well. And that's opening up to all businesses. So we are still digesting the details of the new order, but those are the kinds of things that will be allowable moving forward after next week, Friday. Yes.
I sense some struggle from folks, not just the length of Governor Evers going all the way to May 26th, more than any other governor in the Midwest, and 11 days longer than New York, but also just the fact that people felt like, couldn't he have done it by counties? And now the CDC even permitted, and they said that would be acceptable. So why not that way? I'm just looking at the hospital beds in 15 northwest Wisconsin counties out of 394 COVID patients in this that are hospitalized currently, according to the Department of Health Services today. Only 3 people are hospitalized in 15 northwest Wisconsin counties. So there's quite a difference.
Sure. So the question is, with the order that came forward yesterday, that's starting next week, why was it so long? Why do we think it's so long when that's different than maybe what other states around us are doing and what New York's order looks like? And also, what about doing something less than a statewide order, I think is capturing the question. So first of all, on a statewide order, it is important to remember, if nothing else, that our disease trajectory is different than other states, and how the disease has progressed from something like New York to something like Wisconsin, our timing is entirely different. So we do need to remember that as a state. And certainly, as we get more information from the governor's office, I'm sure that will be part of the question around the specifics on timing. The goal with all of this is really to safely get back to reopening our communities. Again, the end goal, no matter what the date is to make sure that we have everything in place and we are ready to safely and effectively have the people working and our individual families in situations where they are not going to be exposed to a disease that puts them at risk of serious illness and death. So the overall goal with this order all along has been having a healthy and safe community, and that continues to be. The challenge with doing something on a smaller measure than at a state level, I think I talked a bit about yesterday, but again, we don't have walls around any individual region or community in this state, and while it is true we have less impact on this side of the state than they do in southeast Wisconsin and northeast Wisconsin, it's only because the order came down earlier for us in the start of the disease progression. We see that in lots of diseases. Disease spreads, you can see it on a map, and this disease was much more prevalent in southeast and northeast Wisconsin early on than it was here. And the clamp came down and we stayed home, so we have less disease here, and that's why we're seeing that. We know that if we do a region by region or a county by county change, that we will have tremendous challenges with communication and with people being willing to stay with that kind of an order in place. So having a statewide order is best for us. It is hard, especially for those places that don't have a lot of disease, but in the end, even more importantly for us that have low numbers or no numbers, is that we have a safe opening, because my public health perspective is that we in some ways are even more at risk because we haven't had disease locally spread as much as it's spread elsewhere. So a safe reopening, a safer reopening for us is frankly even more important. We need to do that in a way that's slow and progressive and controlled. Yeah.
What's your message to people who, clearly there's a protest rally being planned for Madison next Friday, so the day that the original stay-at-home order was to expire. So what's your message to those even from western Wisconsin that might plan to be a part of that?
Yeah. So what's my message for people that are angry about this? I don't think there's probably a better word. There are protests being planned, and there's a lot of frustration with what is happening. My message is that despite this being as difficult as it is, there is a reason that we are doing this because of the type of disease it is. We have never seen anything like this before across the world. It's a brand new disease that has spread worldwide. People were afraid of Ebola, but we didn't have Ebola spread across the world like this is. We are all susceptible to this disease. None of us are immune from it. And what we are seeing from the data is that many, many people get very sick and die from this disease. So it is not the same as other diseases. It's not the same as the flu, where right now influenza is scary. Many people die of influenza every year. But there are a number of things that make it different. It's a seasonal disease. We know that. It's a disease that we have a vaccine for that is not fully protective, but very protective. We have treatment for influenza. We have a drug that people with influenza can get to make the course of the disease much less severe, the likelihood of dying much less likely. And we have strategies in place and things in place that we deal with that every year. So people that are comparing this to influenza, it's very different. We don't have any of those things in place right now for this disease. When we get those in place, absolutely, we would never use this kind of public health measure except for the fact that this is such a different disease. And I know that's hard to understand. I know people are concerned with their ability to interact in society the way they want to be controlled, the way it's being controlled with this order. And you know, I think we all have to be honest with each other that in fact, we are being told to stay home. That is actually what's happening. And it's because we don't have the measures right now in place to make it possible so people aren't so widely impacted. Yeah.
Out of the 22 positive cases, has there been any reports of any recovery in Eau Claire County?
So the question is, of the 22 cases that we have in Eau Claire, are there reports of recovery? Again, that's a data item that has been taken off the state website and is something that we don't have data on. People in Eau Claire County are no longer actively being monitored for disease and are able to go about their regular business, but we don't have a specific information about meeting the definition of recovery. So we are not reporting that at this time. So thanks, everybody, again. We really appreciate people being here. We know it's hard, and we appreciate the fact that people want to have good information, that they're listening. We want you to share that information with others, so please do make others aware of what is currently happening in Eau Claire, the work that we're doing to try and keep people safe and healthy, and we'll see you on Monday.